There are just some postpartum symptoms you just shouldn't ignore. And today I want to talk about just that. You've had the baby. Everyone says you should be fine by now, but you don't feel it. Your body still feels off. Maybe you're getting flutters in the heart, shortness of breath, weird bleeding from down below. You are supposed to have resumed having sex, right? The 6 weeks are up, but now it's painful. In this video, I want to talk about 7 signs and symptoms that could happen in the postpartum period that definitely should not be ignored. I am Dr. Remi, an obstetrics and gynecology doctor, as well as a mother of 2. I've gone through this before, both personally and in my career. I am building Her Health Room, a place for postpartum women to heal fully, physically, mentally, and socially, whilst also optimizing for lifelong health. Women outlive men, but the number of years women spend in a healthy state are far less than their male counterparts, and that's what I'm hoping building Her Health Room will solve for. Join me on this journey. Subscribe to the channel, comment down below. Let's engage, let's have a conversation, because I really want to be making videos with you in mind. So the first thing is painful sex or tightness. And this can be as a result of something we call vaginismus or anything else related to that. And it can happen after delivery, no matter what type of delivery you've had. But if you've had a vaginal delivery and you've had some tears, it is not unreasonable to think that when you then go to have sex, that those muscles are protecting themselves. But if this goes on for 6 weeks, 6 months, 6 years, it then becomes something that might be slightly harder to treat. The earlier you get on top of it, the better. It's a very, very complex cause from psychological as well as physical symptoms. And the treatment will range from pelvic floor physio, psychosexual therapy, and sometimes even topical estrogen. The second thing I want to speak to is poor wound healing. So again, if you've had an abdominal delivery via cesarean section, that scar can do a multitude of things. It could heal really well, which if that's the case, that's great. It could keloid, so overreact and then you got bumps over the scar. Or there could be something known as granulation tissue, which is a pinky fleshy tissue that tends to weep and produce discharge. And that can happen on the tummy or even if you had a perineal tear. And the issue with this tissue is it just doesn't go away. And I've had patients who will come a year later and that tissue is still there. And often it can be quite easy to treat with some local injections and taking that abnormal part of the tissue away, or putting you to sleep and properly revising the wound. But again, the only way you're going to know what treatment you need for this is if you go to a clinician and seek help. Any sort of bleeding or oozing or pain from the wound is not normal and should not be normalized. The third thing I want to speak to is having a heaviness down there. You're feeling like a pulling or a dragging, and that could be the sign of a prolapse. So in clinical practice, if I'm in a prolapse clinic, yes, you're likely to see women who are slightly older attending, but I wonder if it's because women who are younger just don't know to seek help or there's some shame or stigma around it. But if you've had any type of delivery, again, it could be vaginal delivery or an abdominal delivery, you've carried an extra weight on your pelvic floor for about 9 months. And those muscles get weakened. And so we're really big on the pelvic floor exercises because actually those muscles are so important for your quality of life moving forward. And then those muscles become lax. And then that dragging sensation is what you would call a prolapse, where the organs in the pelvis are not held up as tightly by those muscles. And if you have any of that, the sooner you seek help, the better. Because you could benefit from things like physiotherapy to help with that. If you're getting bladder or bowel symptoms, you could have interventions with that just to help support and optimize your pelvic floor for the rest of your life. And this leads me quite nicely onto the fourth thing, leaking from the bladder or the bowel. And it's such a stigma, and I can completely understand why, right? But if that pelvic floor is not as strong as it needs to be, then the bladder isn't held up as strongly, and then you can get leaks. You could get leaks from sneezing, laughing. I've spoken to women who, anytime they go out, they need to know where the toilets are, almost like they're scanning for exits, because that will determine how well they're going to enjoy their day out, by how quickly they can get to the toilet. The one that's not spoken about as much is bowel leaking, and that is also equally important. The rate of injury to the back passage is significant, and I will do a video about that. And if those muscles don't form properly, say the injury itself was missed or it wasn't repaired properly, but if it doesn't form properly, there's a risk of not being able to hold on to your stools or your wind, or even if you're able to hold on to it, might experience leaking from the back passage. And there's just no strength in those muscles. And that just leads back to the third thing that I was talking about, making sure that that pelvic floor is strong. I'm now doing my pelvic floor exercises just as I'm explaining these to you. The fifth thing is changes in the breast. So initially when you start breast, the breast tissue becomes engorged with milk. And it's expected that as your body's getting used to it, you can get some blocked ducts. There's risk of mastitis, especially early on. But there is also risk of mastitis at any point whilst you're breastfeeding, once you get the hang of it. But it's also the time that you're likely to be touching your breast more because you'll do skin to skin, things like that. If you notice any lumps or bumps in the breast tissue, please get them checked out because there is still a risk of having breast cancer in pregnancy, after pregnancy and beyond. So just being completely breast aware. If you have symptoms of mastitis, so that's like a fever with a blocked duct, your milk's not really coming out, then I would suggest that you seek advice urgently. If you have any lumps or anything like that, especially in the UK, you would be seen within 2 weeks in a breast clinic. 7's quite a lot, but I've got 2 more to go through that I think are really important for your health. We're on to 6. So you might be at home and you're feeling dizzy, you're feeling lightheaded, you're not able to complete your normal exercise. This could be a type of heart failure that shows up in the postpartum period, and it's called peripartum cardiomyopathy. The symptoms seem very similar to anemia, fatigue, or even having a blood clot on the lungs that I've discussed previously, video up here. But it could be this condition. It's not super common, but it is something to be aware about. It might be that you're struggling to sleep or lie flat when you're in bed, you're noticing swelling in the legs. These are all signs of heart failure and they need to be dealt with. And so seeking advice from your GP, maybe your local A&E, but definitely you need to be seen and treated and managed by a cardiologist. And finally, again, this is not as well known. And I've had a patient who had a baby, went home, came back with pancreatitis. Yes, you've heard me, pancreatitis. So if you're getting pain in the upper tummy, nausea, vomiting, the pain is made worse by eating, things like that, that could be a sign that the gallbladder is not working as well as it should. The pregnancy process and postpartum involve changes in the hormones, changes in weight, and all of that can make you more prone to having gallstones. And gallstones in the gallbladder can become irritable and cause infection, but it could also go on to cause pancreatitis. And these are really serious conditions that are not dealt with by obstetricians, but by general surgeons. Even if you had symptoms like that, it would be important for you to turn up to your nearest hospital because it requires treatment, may require surgery in the future. Yes, those are my 7. And I just want you to know that if you have anything that even sounds vaguely familiar, that you go and seek help. Ultimately, I always tell women to trust their instincts, trust your gut. If something does not feel right, speak up. And it is your health, it is your body. In the postpartum period particularly, it's easy to just want to push through, ignore, get on with it. But please do not, because any of these things that I've mentioned here today can genuinely have an impact on your lifelong health span. And therefore, it's really important that you seek help on time. If you've ever been affected by any of these, let's talk about it in the comments below. Are any of these a shock to you? What did you go away learning from this video that you didn't know before? I've got a recovery quiz down below for you to check in really and see where you are in your recovery journey and what you need. Let me know how you find it. Until next time.